understand and appreciate, certainly don't appreciate. And I think people like Henry Foster represent that. You know, he is, without question, one of the most outstanding physicians in the world. His work with the Robert Wood Johnson Foundation on infant mortality provided a model for this whole nation. The program he oversees, the I Have a Future program, has been designated one of the 1,000 points of light. Here are people like Henry Foster who have worked against great odds. You know, Meharry has struggled for years because of having to take care of poor people without reimbursement. And yet people like Henry Foster have excelled in the face of that. And so I just think that that's something that's unfortunately not appreciated adequately by this community. But the nation has a problem, and Dr. Foster defined that problem in the context of Tennessee. There are about 15% of people in this country have no insurance. An equal number have underinsurance. That is, if they had a serious illness, they wouldn't have enough insurance to see them through. So in all, you're talking about over 50 million people in this country who are inadequately insured. And as Dr. Foster said, probably 175,000 here in Tennessee. So we do have a problem. Meharry would like to be part of the solution, and we believe we can be. We're interested in developing models of health promotion and disease prevention, models of access to health care, models of cost containment. I mean, this nation spends more money for health care by far than any other nation in the world. And yet we have one of the worst situations. We have the worst infant mortality. We have more people uninsured, can't get health care, and we spend all this money. We would like to be involved in developing models to show how we can contain costs and at the same time provide quality of care. An example of that will be, and I'll announce this here on this program for the first time, beginning in October, Meharry will begin a monthly community health forum for this community. And the purpose of that forum will be twofold. One is every month we will discuss some major health problem and talk about how people can avoid that problem, or if they have it, how they can get it taken care of. Good example, certain types of cancer, or cancer of the breast, for example, or cancer of the cervix, or cancer of the prostate. What are the risk factors? Or what do you tell a young person to avoid getting those cancers? Or heart disease. I mean, what do you tell people about exercise and diet? Those are the kinds of things we want to talk about. And then we want to have screening programs at the same time. During that same program, we will have people taking blood pressures, doing cholesterol studies, mammography. So this is going to be a once a month. So anybody who says, well, you know, I wonder how I'm doing. I wonder how my blood pressure is. They know that once a month, at no cost, they can go to Meharry and get the answer to that question, and at the same time get information. And that's all a part of what we see as the kind of system I'm talking about, where people are told not only what to do when they get sick, but how to stay healthy.
Very good. And of course, the one thing that I'm especially intrigued by, Dr. Satcher, is Meharry's ability to continue to produce physicians to deal with the underserved. And I think we have to raise a question in terms of the financial support that is often given by the state or by the government in terms of trying to support those physicians. Perhaps during the last couple of minutes you might be willing to say something about the financial support that is probably needed by your students in order to continue to compete.
Yeah, well, I've separated that into our students and our graduates. You know, I am concerned about our students because the federal government, beginning in the early 80s, withdrew its support for medical education in the form, prior to that we had capitation, and we had a lot of scholarship programs for students. Much of that was withdrawn in the early 1980s. So what we have today are students, especially if they're from low-income families, who graduate with very big debts. I mean, can you imagine a student graduating from medical school owing $100,000? That happens every day. It really limits the options that students have when they have to repay that kind of debt. It limits where they can go practice. It limits their specialty. And so you have students saying, well, what specialty can I get in so I can pay this back, you know, within 10 years? And I don't want to see that happen. And that's what we're beginning to see happen. We have been very active with Congress and the federal government trying to get them to restore some of that. And I must say that Dr. Sullivan has provided good leadership because now we do have the National Health Service Corps scholarships back, and they're growing every year, and we appreciate that. But I just think that that's a good example. The other problem we have, we're concerned about our graduates, whom, as you pointed out, many of them practice in inner cities and rural areas. They take care of more of the poor in this country than anybody. And yet, when we don't adequately reimburse through Medicaid, for example, when we inadequately reimburse for patient care, those people end up subsidizing patient care. I mean, Medicaid in New York pays approximately $11 a visit. Medicare pays $33. A private visit would probably be 40 something. So when the federal government does not adequately reimburse for Medicaid, only those physicians who are willing to take care of Medicaid patients bear this burden. I don't think it's something that this nation can continue to push. And inner cities and rural communities are losing physicians and dentists because of that.
Very good. And Dr. Satcher, we've got about a half minute left, and just time enough for me to thank you for coming by and giving us that information about, and especially the information in reference to the merger update, and to in our own small way to simply attempt to encourage you to continue the fight that you are on, because we do believe that the merger is becoming more and more of a possibility now.
Oh, I think so. I think so.
Yeah. When you first introduced it, people wondered about it, but I think that there are the forces that are behind it in the community now in favor of it. And I just want to thank you for coming by and giving us that information.
Well, thank you.
And let me encourage you to tune in again next week for another informative edition of Comments. Good morning.